and thanks for those who have joined us already. We'll just wait another couple of minutes for the rest of the participants. Thanks so much, and please stand by. We'll be starting in just a few moments. Thanks so much. Please stand by. Good afternoon and welcome to our webinar. This is Jessica Kirk from Siegel & Gale. I'm here with Rolf Wolfsberg, Global Director of Quantitative Research. Today we're going to be speaking about managing the hospital inpatient experience. Here at Siegel & Gale, we're the Simplicity Company. We're known by defining, designing, and delivering compelling brand experiences that are both unexpectedly fresh and remarkably clear. We deliver a number of different services, from research to brand strategy to naming and digital experiences. And we'll be speaking about Rolf's research in just a moment. First, let me tell you a little bit about his background. Rolf is a nationally recognized expert in survey research with 44 years of experience. And he's author of the recent book, Fact-Based Branding in the Real World, A Simple Survival Guide for CMOs and Brand Managers. He's a former Rhodes candidate and Woodrow Wilson Scholar, a PhD and Master's in Statistics, and has served as an expert witness before the House and the Supreme Court in Pennsylvania. Rolf's clients are numerous, and in this segment include fantastic providers and payers, and you see just a representation here of the people that, the firms that he's worked with before. It's a very impressive roster, and we're very glad that he's with us today. Thanks for joining us, Rolf.
Well, thank you. And thank you for those of you who are listening in. I hope that you will find this brief time that we have together worthwhile. The slide that you see in front of you now is a prototype of basically the customer life cycle or the patient life cycle. They're the gates that an individual has to go through to become a loyal customer, in this case a loyal patient. In terms of the inpatient experience, the reason that a hospital should care is that the experiences that the hospital's patients have are critical to the hospital from both an acquisition and a retention basis. If the experience is not a good one, the patient will be less likely to return next time he or she needs a hospital, which impacts retention. But that patient is also likely to tell many others about a good or a bad experience, which affects acquisition as well. Research has shown that word-of-mouth recommendation of others is a major contributor to how patients make a hospital choice when they have a choice. The patient experience must be managed through the various touch points between the hospital and its patients. By touch point throughout this presentation, I'm referring to any circumstance or channel through which the patient or prospective patient interacts with the hospital and or its, quote, brand. Touch points go well beyond the obvious things like the admission process, the medical and non-medical staff, the food in the cafeteria, etc. Touch points include the hospital's social media efforts, advertising, bills, brochures, speeches by or interviews with key staff, physical environments such as a patient's room or examination rooms or labs, etc., and so on. Any hospital that practices brand management and patient relationship management, the hospital version of CRM, understands the importance of touch points. It is the experiences at these touch points that determine whether a patient will recommend the hospital to others or if he or she will continue that relationship with the hospital. The challenge is in determining which touch points, if any, to improve when funds are limited. And if you're like most of the rest of us, funds are limited. Hospitals need to determine or at least estimate the return on investment that might come from such investments. But how do you do that? How do you assess the risk associated with a specific touch point? That's what we're going to talk about today. I'd like to offer up an 8-step process for prioritizing touch points and subsequent investments in those touch points. Number 1, create a journey map that identifies the various touch points. Step 2, create a list of various service aspects or performance aspects within each touch point. The third step is then measure satisfaction with the touch point and the various performance aspects among patients. Step 4, determine the importance of each touch point to the overall hospital experience. Step 5, determine the percent of all patients who experience a given touch point in a given time period and the resulting impact of that experience on the hospital. And I'll talk more about that as we go. That's a mouthful there. Step 6, we now repeat those prior 2 steps, steps 4 and 5, within each touch point for the performance aspects. So once you are focusing on an individual touch point, let's do the same process of looking at how that experience lived out and among how many people for the various aspects of service within it. Step number 7, let's estimate the difficulty and or cost associated with improvements to each performance aspect. And then finally, step 8, at this point, we are now ready to create a short-term, medium-term, and a long-term improvement plan for investing in the hospital experience. Okay, let's start from the beginning with step 1. Step 1, create a journey map that identifies the various touch points. This is an important task to undertake even if you aren't planning to use it as part of the measurement process. A journey map represents a quasi-chronological sequence of touch points that a patient may encounter before, during, or after his or her hospital visit. Carefully laying out how a patient interacts with your organization and in what usual sequence can be very helpful in informing you how you should organize your service delivery, as well as getting a better feel for what the patient experience is really like. What you see here is an example, a piece of a journey map for a public utility. While it's likely difficult to read this on your screen, the map lists every interaction that might occur within a given customer goal or mindset. For example, I want service to start at my home today, might be the goal. In addition, the map can include potential on-stage and backstage actions that could be taken, and an assessment of how positive or negative this interaction tends to be today. That's the graph you see at the top of, in today's world, do we think that this is a positive or a negative experience for the customer in this case? Recall that by touch point, I'm referring to any circumstance or channel through which the patient or prospective patient interacts with your hospital. Literally, this could refer to every conversation a nurse has with a patient in the hospital, every lecture a doctor gives at a seminar, every time your foundation sends out a donor request, etc. While each of these contacts represents a moment of truth in the delivery of the brand or the hospital experience, for patient experience measurement and management purposes, it's probably better to focus at a higher level on these various channels or interactions, rather than a specific interaction. After all, a patient experience improvement plan is not going to focus on every conversation with the nurse. It's going to focus on nurse-delivered service. I'm going to demonstrate the 8-step process today through an actual study of the patient experience nationally. Last year, Siegel and Gale conducted a nationwide survey of the hospital experience among 500 patients, or in some cases it was primary caregivers in the case of children or infirm patients. And these people had to have spent at least one night in the hospital in the previous 6 months. Now, by design, the study omitted experiences of individuals who were treated and released from the emergency room on the same day, for example, so the outpatient experience is excluded. We did this to focus on individuals who would have been exposed to a wider variety of touch points during the experience. So again, just to set a context, this is the inpatient experience. There are numerous touch points that a patient can experience. The first step is not to try to focus on them all. There are some, obviously, that I think intuitively you can determine are minor, or there are some that are very rare when it occurs, so the impact is likely to have on the total hospital is going to be minor. So there has to be some heuristic or judgmental decision-making done first. In this case, we determined that we would focus on 15 touch points that you see in front of you there. There's sort of chronological in the sense of scheduling to the emergency room, if that's how someone actually came through into the hospital, for the admitting process, if they didn't go through the RA, the ER rather, et cetera. So you can see the 15 there. Let's move to step number 2. Now that we've mapped out what the touch points are, in this case we have 15 of them. We then want to create a list of various service aspects within each touch point. Now, any effort to improve the patient experience at a touch point requires a plan. How are you going to improve the intake or admitting touch point, for example? Through the appearance of the waiting area, the comfort and privacy of the interview area, the personal touch of the staff member, the delivery of relevant facts, the clarity and simplicity of what you say or what. In order to build a plan and determine how much an improvement in a specific aspect of the touch point would impact the entire patient experience, you need to develop a list of the aspects that are available to you to address and improve. So here again is an example for one of the touch points. Let's take the hospital room, for example. We came up with a list of 13 different aspects to have the patient rate in terms of determining what their actual experience was with each of those within the context of the hospital room. I won't go through and read all those, but you can see what we have there. So the third step then is we need to measure satisfaction with each touch point, and also within, or with, I should say, each aspect of service within those touch points. Well, how is this traditionally done? Many hospitals do this through transactional surveys. That is, they contact patients shortly after they've had an interaction with the hospital and ask them to recount their experience through a series of questions. Such a survey would normally include satisfaction with the various aspects of service, as we just developed, as you saw in the previous step, for a given touch point or transaction, as well as overall satisfaction with that touch point, and then with the entire organization, in this case, a hospital. Now, while this method likely will produce good feedback on the specific touch point, if it was the admissions process, for example, because it'll be very fresh in the patient's mind, transactional surveys will not provide a good understanding of how the touch point contributes to the overall patient experience. A transactional survey examines the patient experience at a single touch point, but the overall patient experience is a composite of the experiences with a variety of touch points. As the touch points that are, quote, touched will differ from patient to patient, as will the experiences of these touch points. this becomes a complex process. Let me give you an example. Even though we're talking about hospitals today, I imagine that most of you have spent time on an airline. Let's go through the following business flyer example for a woman who's off to a very important meeting. So she arrives at the airport to fly to an important business meeting. She goes to the ticketing kiosk only to find out there is a problem with her ticket requiring that she speak with a counter representative. There's a long line at the counter that costs her another 15 minutes of wait time. When she finally gets to the counter, the passenger learns that her ticket was improperly booked and must be reissued, taking more time. A long wait and is the next experience in the security line. I'm sure we're all aware and have experienced those. Once through the gate, she realizes that through the security rather, she realizes that her gate is at the end of a very long corridor. So finally arriving at the gate, she learns that her plane has already departed, and subsequently she misses her business meeting. She contacts the airline's customer service call center to complain, but the fact is the damage is done. The result is a very angry customer. But which touch point is to blame? Was it the kiosk interaction, the counter experience, the original ticketing agent, the security staff, the customer service call center she contacted at the end of the experience, or all of the above? The only element that didn't contribute to missing the flight was the call center. But if this passenger had been contacted in a transactional survey of recent callers to the call center, something that many companies now do as a standard part of their customer research, their customer satisfaction research, it's likely the dissatisfaction would have appeared to be associated with the passenger's last point of contact. So the call center would likely take the fall for this. In order to understand how the touch points interact with each other, we need to study the touch points together in the same survey. This allows us to both identify what touch points tended to be co-experienced during a given time frame, and to isolate the contribution of each to satisfaction with the overall patient experience. Many organizations use the Net Promoter Score as a metric for evaluating customer or patient experience. I don't know if any of you do or not, and in some cases we've talked to hospitals who've derived their own improvement on the Net Promoter Score, etc. This technique that I'm going to walk through applies to all of those. It'll work with anything. You just have to have some form of measurement of the overall patient experience. The Net Promoter Score, if you use it, as you know, is derived from a single question. How likely would you be to recommend this organization to others? Whether a recent hospital patient would recommend the hospital to others, of course, depends on his or her entire experience with the hospital, not just necessarily the most recent contact. And these interactions might have occurred over a period of time, not concurrent with each other, or possibly even within days of each other, such as receiving bills that can go on in some cases for months. For this reason, the context of the survey should be probably a 6-month period, maybe a year. You want to make sure the time period is long enough that it includes any touchpoint interactions that could be affecting the likelihood to recommend the hospital, or whatever metric you use. But you don't want the time period to be so long that patients cannot recall the specifics of the interactions. So there's a bit of a judgment call involved here. One could reasonably argue that the quality of information received from a transactional survey conducted within days of the interaction is superior to that of a survey that's inquiring about an interaction that occurred 3 months ago. True as that may be from a factual standpoint, the general feeling a patient has from an organization is based on perceptions of the experience, not necessarily the facts. For example, I've done studies of customer satisfaction in banks where one of the questions is, how long did you stand in line? And we actually measured it with a stopwatch compared to what they said. And what we found is that if the customer saw a teller doing something other than serving customers, it actually doubled the amount of time they thought they stood in line, because it raises their anxiety level and their irritation level. So it actually affects how they would report that metric. Hence, for purposes of understanding how the various touch points work together in the overall patient experience, Studying them together is superior. Of course, the ideal solution, if it's affordable, is to conduct both types of surveys. The composite study can be used to understand the importance and impact of each touch point, and the transactional surveys can be used to give you a better measurement of the actual experience at a specific touch point. All right, let's move to step 4. Let's determine the importance of each touch point. This is the most difficult of the steps. A few years ago, I spent a lot of time researching this topic of how do you prioritize touch points if you want to manage either the customer experience or, in this case, the patient experience. So I went to one of the popular search engines and entered in touch point management and got back 2.5 million references. I read several of the articles, and almost all indicated that one of the first steps in touch point management is, quote, to prioritize the touch points. Well, duh, no argument there. That's what I was trying to do, and none of these articles shed any light on it at all. I could not find a single article that provided a rigorous method for doing this. In my experience, companies tend to prioritize touch points in one of two ways. In the informal approach, a group of individuals within the hospital sits down and discusses recent patient satisfaction feedback, either through research or call center feedback. They prioritize touch points basically based on the squeaky wheels, i.e. those with the highest complaint levels. In the more formal version, the hospital may conduct a survey of recent patients and ask them to rate or rank the importance of various touch points as well as their satisfaction levels within each. The results will get plotted on a grid. The touch points where the hospital's performance lags the stated importance are then given priority for improvement. Neither of these is adequate. The second method at least introduces a modicum of rigor, but it also is not sufficient to really allow you to optimize your management of touch points. This is because stated importance can be a very poor indicator. Individuals often can't articulate why they make choices or how they allocate importance across various factors. Respondents are much more likely to tell you what they think you want to hear or what they think will make them sound smart and discerning. Researchers continue to rely on this approach of stated importance, but the answers just are not valid. So I discourage you from using that as a method for identifying what really affects the patient experience. So why is it difficult to prioritize touch points in a more rigorous way? Because the overall patient experience is the aggregate of all the touch points he or she comes in contact with. This means you can't simply survey patients who recently contacted a patient's service line, for example, and determine the impact it had on the experience. That's like looking at just one brick when you're trying to evaluate an entire building. There's another complicating factor in prioritizing touch points, and that is that different patients come in contact with different touch points. So if you try to use traditional statistical analysis tools like regression, and I'm not trying to turn you all into statisticians here, although I'm sure all of you wish you were, that's probably what your real calling was, but you just had to do something that was more exciting instead. But if you were trying to do that, you would have enormous amounts of what we call missing data because there's just no response for something they didn't go through. These holes exist because many respondents simply have not experienced all the touch points, so they may not remember some that they did. All in all, these issues make the problem very difficult. In 2010, after trying to solve this problem for almost 20 years, I was able to develop a statistical tool we call Pinpoint that actually uses a creative method to get around these issues. Basically, what Pinpoint does is it applies the experience of other respondents who are otherwise similar in terms of their experience to what the individual is, and we're able to figure out what the touchpoint experience likely would have been for a respondent who didn't directly experience it. So that is, I found a way to estimate the level of satisfaction for each missing touchpoint that would have no impact on their overall experience because it would be consistent with everything else they talked about. I could then use the statistical tools and then back the things they didn't experience back out. Again, I won't go through all the details there as much as I'd love to and do the Greek letters and subscripts for you, but for purposes, I just wanted to give you an overview that we can get around this problem. So let's see how this works in our hospital example. Recall that we looked at 15 different touch points, and before we present the findings, I'd like to just do a brief exercise. For any of you that have not fallen asleep yet or gone off to check your emails, I'd like you to take a piece of paper, and I'll just stop for a minute, and write down in order what you think the top 5 most important touch points are in terms of how they affect the patient's hospital experience. Starting with what do you think the most important of these 15 was in terms of the impact it has. Let's just take maybe 1 minute. Okay, that wasn't quite a minute, but just in case you either didn't do it or whatever, let's take a look at what we found out. Okay, here are the results. The pinpoint analysis reveals that the hospital's nurses are the single most important touch point along the patient journey. While the reputation of the hospital's doctors may be the most critical element or one of the most critical elements in the patient's choosing that hospital in the first place, the interactions with the nurses have more influence on whether patients would recommend the hospital to others and whether they want to come back than did the doctors. So how did you do with your guesses as to the relative importance of the touch points? One of the most often voiced complaints about hospital stays is the quality of the food, but this has virtually no impact in reality. Did you expect to find the experience of the nurses to be twice as important as that of the doctors? What about status updates being twice as important as the treatment or the individual procedure is itself, the outcome, the actual outcome? How can this be? As I mentioned earlier, I spent about 20 years of my career focusing on patient satisfaction. Well, actually, I just mentioned it took me 20 years to solve this. But while most of this was in the for-profit world, I saw time after time that what makes or breaks a customer experience is the presence or absence of anxiety. For example, I would see companies that would do a great job of fixing a complex billing problem within hours of being contacted by the customer. The problem was that they didn't let the customer know the problem had been fixed. After all, the customer would see the problem had been fixed when they received their next bill. So what was the result? The result was the customer had a very bad experience because they spent the next month, the rest of the month, worrying about whether the problem had been fixed. And so instead of being rewarded for the company's great service effort in fixing the problem and fixing it fast, the company got penalized because it didn't let the customer know. A trip to the hospital is fraught with anxiety. The research confirms that the primary objective, after getting the procedure done correctly, of course, is eliminating as much of that anxiety as possible. And it's the status updates and the nurses who deliver those updates and hold the hands of the anxious patients who play the most important part in reducing that nervousness and worry. You may wonder why the outcome itself is lower than many of the other touch points. This is mostly because the procedures are rarely done incorrectly. Think about your bank experience. How much do you worry about your statement being incorrect? Very little, I would think, unless you're dealing with a very bad bank. But if banks started making statement errors on a regular basis, you would see the importance of that touch point increase considerably. So, step number 5, determine the incidence of exposure and the impact for each touch point. Isn't that what we just did? Actually, no, and I'm sorry, I don't want to get too technical here, but all we did is looked at what the importance is of each touch point if somebody had experienced all 15 of them. But they don't, and as a result, it affects how much each impacts your organization overall. Why is measuring the incidence of each touch point important? Because while a specific touch point can be very important to an individual who experiences, if only a minute fraction of the total patient base experiences the touch point, it will have very little impact on the Net Promoter Score or other patient experience metric the hospital may use. Importance to the individual does not guarantee impact on the organization. I use the term incidence to cover both cases where the patient does not experience a touch point at all, or has no memory or recall of it, and therefore cannot rate his or her satisfaction with it and the elements within it. While bad experiences on elements that are not recalled could have some subconscious effect on the touch point or overall experience, it's more likely that bad experiences would be remembered. For this reason, the models we build assign no impact to an element that isn't experienced or recommended, or remembered, I'm sorry. All right, a little bit of a complex chart here. I apologize for that. We're doing two things in one slide. The line across the top actually shows the incidence of how often people both experienced and remembered that touch point. So the percent of patients or caregivers that experience, for example, nurses is at 99.2%. Well, obviously they all experienced a nurse, but some 0.8% of them didn't recall that experience, etc. What you see is that most of the touch points are experienced and recalled by almost all of the patients. That's not real surprising, given the touch points that we picked. Billing occurs for almost every patient, but not every patient deals with the bill. It might be someone else who does. That's why you see the incidence of that lower. And of course, we're only doing the inpatient experience, so those that came through the emergency room would be relatively small. In this case, and the national average was 6.7%. So that's going to affect the impact that each has. If we go to this next slide, you'll see that when we take the incidence of exposure into account, we can calculate the impact of each touch point on the hospital as a whole. That is, on the Net Promoter Score, on your overall metric that you measure the customer experience by. The impact of the touch points is shown here. Note that the impact of high incidence touch points, such as the room and physicians, are higher than the corresponding importance figures we showed earlier. And similarly, the impact of a relatively low experienced touch point, such as the ER or billing, are less than the original importance. That's because not everyone experiences it, so the impact it has in your hospital will be correspondingly less. Once the impact of each touch point has been determined, it's useful to plot satisfaction against impact. This is the first step in determining which touch points are potential candidates for investment and improvement. In creating such a mapping, I found that it's useful to add a couple of threshold indicators, which are represented by the dotted lines here. The horizontal line, which is set judgmentally, I admit, represents a threshold below which the touch point has so little impact on the organization overall that it likely doesn't merit investment. The vertical line, also set judgmentally, represents a satisfaction threshold beyond which there's little room for improvement. In this case, it's set at 9.5. That's on a 10-point scale, that's an extraordinarily high threshold. But we did see in the hospital experience, we were getting mean ratings in like 8.5, 8.6 range, which are phenomenally high. We do not normally see scores that high, so that's a kudos to your industry, etc. Investments in touch points where satisfaction is beyond this threshold would mean you're making improvements that would affect only a very small percentage of the patient population, people that aren't already completely satisfied with the experience. So it might not be prudent, given the greater opportunity represented by other touch points, to make your investments there. The prioritization map here suggests there are several touch points that are not good candidates for investment, simply because they have too little impact. That's like the much criticized food touch point. You'll notice this down in the area there where it's not going to have that big an impact. While it did get the second worst satisfaction rating, as I said earlier, you do get a lot of complaints about food. The research shows that even large improvements in satisfaction with this touch point would barely affect the overall satisfaction score for the hospital. So even making that a gourmet experience might get a lot of stories told about it, but it won't change how they ultimately affected the experience. It won't remove their anxiety. Okay, and similarly with the ER, you'll see it just wasn't experienced by enough. So again, that is probably not one that would, for inpatient experience, would be a good target for investment. In contrast, investment in hospitals' nurses, status updates in the hospital rooms have significant potential for increasing satisfaction with the patient experience. Physicians and the treatment of the procedure itself also have sizable impact. The satisfaction levels for those two touch points are somewhat near the threshold and therefore limit the opportunity for improvement. I hope I haven't lost you by now, but let's move on to step 6. Let's determine the importance and impact of various performance aspects. What we've done so far is do that for the touch points, but now let's take the ones that look like there's some potential there, like the nurses or the hospital room or whatever, and look at what can we do to move that touch point to a better place. The previous chart represents a rigorous method for prioritizing touch points. Let's do the same thing now within one. What would the cost and effort be of improving the treatment or procedure touch point? What if it's 10 times that of improving the discharge touch point? That cost has to be considered when we take this into account as well. So the first thing we want to do is actually build a similar type of map that would look within a touch point. And here you'll see it for, I took the hospital room touch point. At the end, I'm sensing that some of you may want to see some others, so I have a couple of others prepared if you want to look at it. But here it is within the hospital room. Again, using the thresholds for the top and to the right, you'll see that we can now look at what things would possibly make sense to improve if the room was our target. So first we impute the likely experience for missing aspects the same way we did before. You'll probably find there are far fewer missing cases here because somebody who has now done the room, experienced the room, should be able to rate the various aspects of service within it. But an example of how you might have something missing is possibly a hospital patient doesn't care to watch television. So he or she may have never turned it on to see whether it was decent or not, and as a result, they couldn't rate the experience with the television. After the importance measures are determined and adjusted by the incidence of each to yield the impact, we can plot the performance of each aspect against its impact on satisfaction within the touch point now. The extent to which an aspect affects the overall patient experience depends on both its impact on the touch point, but also the touch point's impact on the patient's experience overall. All right, we're getting there. We aren't quite done, though. We still need to consider the cost element. While the actual research is being conducted, you can also assign a team within your organization to assign a measure of difficulty or cost that you would associate with each performance aspect. At this point, a rough measure of difficulty or cost should suffice, maybe a 3-point scale of high, medium, and low, for example. Okay, so now if we look at that again, this is the same map you saw before, we might be able to code on there a color coding that says which ones would be a high ticket item, like increasing the visitor space in the room, or the bathroom itself might be highly expensive, or creating privacy, making every room into a private room, whereas something like changing the lighting could be a very low difficulty type of thing. So as you look at the map again, this time adding the difficulty and cost indicators, it becomes very clear which things we could do, not only in terms of how much impact they'd have on the experience, but take cost into account so that we can try to look at return on investment. And in fact, if you go back to how much impact each aspect had on the experience and look at how many of those are each of the 3 buckets, we can actually now take an assessment of the entire touch point. So if we wanted to, for example, improve the hospital room, we could accomplish a quarter of the job at very low cost. We could do 75% of it at low or medium cost. In other words, it now gives us a metric of comparing the various touch points against each other in terms of what's involved, how much cost and or effort would be involved in doing that. Now you have all of the information you would need to make an informed investment plan. You have the impact versus the cost or effort effect for each aspect of each touch point. So to summarize, prioritizing touch points doesn't have to be an internal guessing game. In assessing an individual's patient experience with the hospital and isolating the impact of various touch points, you need to consider 4 factors. 1, which touch points the patient experienced. 2, the impact of each touch point on the patient's overall experience and likelihood of recommending the hospital. 3, how satisfied the patient was with the touch point experience and the various aspects through which the experience was manifested. And 4, the difficulty and or cost that would likely to be associated with improvements to each performance aspect. Transactional surveys play a valuable role in the patient experience management process. However, to understand the composite experience and how various touch points affect that experience, you likely need to study the touch points jointly, as I've summarized throughout this. And a tool like Pinpoint can be used to isolate and parse out how much individual or how much impact came from each individual touch point, all of which go together to reflect the overall patient experience, and that allows us then to build a responsible investment plan. So that's what I wanted to talk about today in terms of what we learned. At this point, we'd like to open it up to questions and answers. I'll turn it back over to Jessica.
Okay, great. So at this time, we'd appreciate it if you have a question that you'd like to pose to Rolf. Please go to your screen and please type in a question. We do have one already here, so if you're ready, go ahead and type in more questions, and we'll get started with the first one. The question, Rolf, is basically, can you cover which of the drivers, both the touch points and the service elements of positive patient experience are? Obviously, you touched on that with the nurses, with the status updates. Do you want to just expand on that just a little bit more?
Yeah, we could. Like I indicated earlier, I did prepare a couple of slides anticipating that might come through. If we could actually fast forward to a couple of slides, I'd put a couple at the back of the deck. Here's one. It's not the mapping. I didn't actually put it into the map format, but for nurses, because that was such an important thing, you'll see that what was most important here, 25% of how somebody would rate their satisfaction with the nurses would be in response to how responsive they felt that nurse was to requests and or issues. And then the second highest was respect shown to me and or family members. But if you come down there again, you'll see attentiveness of the nurse, et cetera. You'll see that a lot of it has to do with, is that nurse there for me,
right,
so that I can find out what's going on, et cetera. So it's heavily about that anxiety experience that we saw before. And if we want to do one more, if we look at the next one, for example, this is the patient updates. It's the frequency of the updates that was dominant here, and the length of time between the procedure and getting the feedback, because this is like the bill that I talked earlier in terms of the customer service call about somebody who had a billing issue. If you do something until that patient actually learns the outcome, they're going to be extremely anxious, extremely nervous. So you see that theme come through again and again. Of the key to inpatient satisfaction management is remove anxiety everywhere you can.
Fantastic. Please, we have another question I'll read in a moment, but please, those of you who are listening, please do pose your questions, and we'll look forward to getting to them one at a time here. Rolf, can you comment about particular provider systems a little bit, and which ones have really figured it out and are building a great patient experience? Do you have anyone who's best in class that you'd like to highlight?
Yeah, that's a great question. And we actually did ask people in this study to indicate the hospital that they were commenting on. But as you can imagine, with only 500 people nationwide, given how many hospitals there are, we don't have enough that we can actually use these data to answer that. So I mean, I would love to be able to say I could, but from our own experience, I know we've done a lot of work. I wasn't a part of it, but this organization's done a lot of work. For example, with the Cleveland Clinic, and they are doing a lot of things extremely well. Although of late, I think some of that has they're starting to give a feel. I know from research I've seen where maybe they're feeling a little bit corporate now, but they had that for a while. But if I were to give you one experience that I think is number one, it may be the Mayo Clinic, because they go all out. It's what they live, it's what their DNA is, what their promise is, and from everything that I've heard and experienced, they do live it. That's I fear not a complete answer to your question. It's the best I can do. I'm afraid.
A qualitative question out of a quantitative study.
Yes,
Cleveland
right.
and Mayo. Fantastic. There's a question, just how, where would you get started? Where's the best place to start when you're deciding where to invest?
Well, it may sound elementary, but step one. I mean, the first thing you've got to do is you got to map the experience, and doing a journey, what we call a journey map, you don't need us to help you do that. That you can do that. I mean, it's literally go through and figure out, put yourself in the shoes of a patient and map what happens. What touch points do they go through? What do you think the experience is like? Whether you do it yourself, go through your own hospital and feel what that's like, and you'll get a feel for that. I just want to caution against just going by what you saw in the presentation of just get some people together and see where the complaints are, or do some of that transactional survey mapping. That can lead you astray. You first of all need to get a feeling of what that journey is all about. That's a great place to start.
Thanks so much, Rob. Let's just give another moment for folks to go ahead and take a look, and if they want to answer a question, please go ahead and do so, or raise your hand, and I can chat at you if we need be. Just while we're waiting for that, just a quick view again of Ralph's contact information. If you'd like to be in touch following this webinar, we encourage you to do so. R. Wolfsberg at SiegelGale.com, and myself, Jessica Kirk, Kirk at SiegelGale.com. And of course, we'll have a replay of this available in a couple of days so that we can have you share that with colleagues, perhaps that couldn't listen. As we're thinking about this and staying in touch and how you've done this work, any final thoughts, Rolf, that you want to leave this group with?
I hope that I've summarized it fairly well, but again, the one sentence suggestion was that it's all about anxiety, and that really is a lens through which you can evaluate every one of your touch points, whether it is the signage and wayfinding within your hospital, whether it's the way people talk to and how often they talk to the patients. Anything you can do to alleviate anxiety will be well rewarded to you.
Well, finally, let me just leave you then with maybe one question that sort of burning in my mind. You've done so much research in this area and pinpoints on other fields. Can you talk a little bit about the transferable knowledge from this type of work? What can people who are in customer experience roles, or consultants, or those who sort of practitioners in this space, not in the industry, what can they take into other fields?
The process is identical.
Mm-hmm.
In other words, this deck could have been labeled anything. Could have been for a utility. It could have been for a bank. In terms of the process and the way you do it, that's transferable completely. Also, what was interesting to find is that anxiety is the same here as everywhere else. That's just, even the way people make decisions in terms of what they buy, it isn't just the patient experience. People buy brands that actually relieve anxiety from them. It's what do they get rewarded for and what do they get punished for? If you think about that, you'll figure out what brand somebody's going to buy. They want a company that's easy to do business with, that they can find what they need easily, that they know that their product won't break.
Right.
This is a far cry from the hospital experience. It's now going into acquisition more than retention. But the same themes play out themselves again and again and again. For 44 years, I've seen the same things play out. So I almost hate to say that. I want people to think it's really complex, and they need guru help at every step of the way. But a lot of this is much more intuitive than you might think if you just put yourself in the shoes of the other individual and understand what causes discomfort.
Fantastic. Well, we're so glad that you could join us today for our webinar. Thank you very much, and we'll look forward to seeing you next time. Thanks, Rob.
You're welcome. Thank you.